Hello, welcome to the Dear Encourager podcast, where real stories meet radical hope, hosted by Vanessa Scott and Keisha Nix. This space is made for anyone navigating the journey of chronic illness and caretakers seeking connection, compassion, and a community that gets it. Each episode, we bring you conversations that uplift, strategies that empower, and encouragement you can carry with you throughout everyday life. Let's grow stronger and healthier together. Today we have a special guest, Miss Yoli Campos-Smith. She is a nurse, a healthcare liaison, and she's joining us today to talk about hospice. I'm so glad you're here.
Well, I'm excited to be here.
Yoli, could you explain to us what hospice care is and isn't? Because there's a lot of misconceptions out there of exactly what hospice is.
Absolutely. And you're exactly right. There's a lot of misconception because if I bring up the word hospice, what do y'all think about?
Yeah.
Exactly. And that's what everybody else thinks. Not my mama. We're not there yet. Because in a lot of people's mind, they see hospice as somebody's last few moments. And it's our job to get the word out there that it's not. It's for people that are having declining, that have a disease that's life limiting. And we come in when we know we're at our end of life time, but end of life can be anywhere from 6 months to, we know people that have been on hospice for a couple of years. Now, so what we do is we come in, and when medical management, we're getting treatments, going to the hospital is no longer an option, or that the patient himself or herself decided, okay, I'm done. I just want to be comfortable. So hospice is all about treating the symptoms, making their life quality and as comfortable as possible.
I like the quality life. And I think that's what's most important, that we understand that hospice is making sure that our loved one is having quality life at the end of this term. Doesn't mean that, like you said, could be 6 months, could be a couple of years, but making sure that care is managed and that they are comfortable.
And we bring the care to them.
Yes, you do.
Hospice brings, the nurse comes out, you get a whole team. We have a nurse, a nursing assistant that helps with bathing. We also have a social worker and a chaplain. So we all kind of get together and find out a customized plan for that patient. Not everybody, it's not a cookie cutter. Not everybody needs all of the services. Some people need pain management. Some people need respiratory management, maybe those COPDers. And we also support the family. That, I think, is one of our biggest resources.
Yes, I was going to mention that, especially when you said the social worker. I think that a lot of families don't understand that if my loved one is sick and I'm having some issues, challenges, dealing with this transition, this journey, that I can reach out to that social worker, that chaplain, people that can comfort and help me understand this process. And also you guys, I know you guys do a great job at that, helping not just the patient, but their family understand.
Absolutely. I think our resource meaning are educating the family about what's going on right now, what is normal, and what is to be expected, and maybe what the next steps are is so important. If the family can wrap their head around what's going on, it makes their job so much easier.
It does. And I also think some family members don't realize that hospice is also for them. Because when you offer them the actual social worker and you offer them the respite services, it helps them, because what we, as Dear Encourager, we try to explain to our actual, members, clients, we're still trying to figure out what the name is for them. We try to tell them that it's okay to say you're tired. And so if they have
frustrated.
Oh, yes.
Exactly.
They're worn out.
Yes.
We're trying to tell them that in those moments, it's okay for you to actually go and seek assistance. The thing about Dear Encourager, what we've been trying to explain to the caregivers, that it's okay to ask for help. And then it's with hospice, they usually wait too long. And what I wanted you to come on here and talk about was that hospice services doesn't have to wait, to the last minute. And I wanted you to explain that it's okay for people to go on hospice and come off hospice, even if needed, and that's something, especially within the Black and Brown community, is I think they don't use hospice services enough and at the right time.
It's not just the black and brown. I can say that because I'm Hispanic and Indian people, different cultures are, because I know in my own culture, we kind of feel like, hey, we're responsible for our elders. And a lot of other similar cultures feel that way, or we're giving up if we have hospice. But actually, studies show that people live longer on hospice care because did y'all know that number one, Medicare covers us 100%? And that is the equipment that we get for them, their briefs, for their incontinence, their wipes, medicines related to pain, infection, symptoms like nausea, vomiting. We cover all that. So can you imagine the expense of briefs every month for some people on a limited budget?
No, I can't because I know
they're very expensive. Okay, not only that, but our caregivers, our nursing assistants come in and they help with bathing and showering if the patient can get up to take a shower 2 to 3 times a week. They come out, they can change the sheets on the bed. All right. Plus, our nurses are available 24/7. Now, oftentimes they handle the call or the concern over the phone. But if it's something they feel strongly, hey, I need to go lay eyes on those patients, they do. And we can call the doctor at any time at 2 a.m, 3 a.m, Sunday afternoon, and get what that patient needs. If their pain medicine isn't working for them, if they have like an infection, a respiratory infection, and we need antibiotics, we treat people on hospice. We do wound care. So people think that hospice is, oh, you come on, you take all the medicines away, you just sit and wait for them to pass. And that is further from the truth. A lot of times we do take away some of the medicines, but what we do is look at medicines that are no longer beneficial, like cholesterol. We're not going to worry about cholesterol in the last season of somebody's life, And so sometimes when they take all that extra stuff out, because, everything has side effects, right? Yeah, and so, and we also look at that patient and say, okay, what do we need to do to make this patient more comfortable and make the family comfortable? So we do a lot of teaching how to care for a patient. And, as they progress, their needs change. So we can even, our staff comes in and teaches them how to care for. I bet you've never had to change well, maybe you, because you're a nurse, but have to change a patient in bed. That's a skill. Yeah. And we can teach you the tricks on how to do that easier. The hospital bed, so you're not stooping over. There's just a lot that I think, and I hear from patients all the time, I don't know why I waited so long.
Yes.
And the respite care.
And I think that is the beauty of hospice. And I want to use the word beauty so we can get rid of that stigma of what hospice is.
I see that all the time.
Yes.
Something that's not so scary for people.
But I think if we talk about it more and we educate and encourage people to reach out and have these conversations. I know a lot of them are hard for us to have because, death is scary for, it's.
And you don't want to talk about mama passing.
No, nobody does. Mm-hmm. Even if it's right there, even when they are talking about it, we don't want to talk about it. But I think that hospice opens the door for that. And I believe that you and others educating and informing us of how we can have these conversations and what the care team does. And I think that puts us at ease because as we know, having those difficult conversations, having to make that choice. But when we have someone to come and help us.
And explain.
Yes.
And you had mentioned about coming off of hospice. Now, sometimes, especially like cancer patients, sometimes they get a second thought and they said, I want to go try this. It's their life. It is their right. You have a right to come off hospice. You have a right to change companies. You have all these rights. And you have a right to say, all right, further down the road, I do want hospice. Now the philosophy of hospice isn't to flop back on and off all the time. Right. But if people think you can't go to the hospital, if you were to fall, and we were worried about a fracture or you had a laceration that needs to be sutured when you go we'll send you to the hospital, get all that taken care of, and then you come back.
Okay. Do not resuscitate.
Great conversation. And so when I meet with families, this is how I bring it up because nobody wants to say, hey, do you want to save mama? That's not how we talk about it. So I come in, I said, if we were to come in and see your mom and we notice, hey, she's not breathing. what do you want us to do? Do you want us to do the CPR? Do you want all the, resuscitation? Mm-hmm. Or do you want to let nature take its course? And then they stop and they think for a little bit. They say, oh, we wouldn't want that. And I say, okay, then you need to have that in writing. A social worker can help you with that. A hospice social worker can help you get that going. Because if you don't have that and somebody meaning very well and calls 911, guess what happens? Everything happens. Maybe mom had already decided she never wanted that. But if you don't have it in writing and they call 911, all bets, everything's off. You have to do it.
And you have to do it before they transport home.
Yes. Well, yes and no. Okay. I have some families that they refuse to sign a do not resuscitate.
Okay.
And that is their right. It's not a requirement to be on hospice. However, the ambulances don't really like it when they take you home. I've had patients that went home in an ambulance without a do not resuscitate. But you're right. More times than not, they want that paper.
Okay. I just want to make sure because I know I was in a environment and there was a discussion going on and it was very passionate between the ambulance company and the nursing staff because they were like, wait a minute, this person is on hospice. So what you mean they don't have a DNR? And they don't have a DNR.
And I like that you stated it's their right. Making sure that, especially in that season, that patients understand that you still have the right, no matter what's going on with you, to say no or say yes, this is your care. Mm-hmm. How do you want it? And I think that's very important. One thing I wanted to also discuss before we end is grief for the patient, grief for the family. And I do know that you guys offer the grief counseling, but just to talk about, when do y'all start it, or when would you recommend for families to start the grief counseling process?
Well, we start talking about it at admission.
Exactly.
Because especially like with people that have a dementia, that person is not the person they knew. Mm-hmm. Or even somebody that has is very, very sick, So we also follow families afterwards for 13 months. Yeah. And we've had families that reach out, and I still have families. Some of my best referrals come from former families that we served. And that speaks volumes, So yes, and definitely, because everybody, no matter how much you think you're prepared for it or you're okay with when it's time for them to pass, it's still shocking.
It is.
So we do a lot of preparing from the point of admission, including funeral planning, because people go, why do they ask right away? Mm-hmm. I said, because we don't want to ask you when we're surprised that happened earlier than we thought.
And hospice has a special place in my heart because my grandfather was put on hospice. As she said, I was a caregiver for my mom, but I also was a caregiver for my grandfather, and he passed in 2006, and he had been on hospice only a few months when he passed, but they did offer grief counseling and things of that nature. Did not take advantage of it at that time, but I definitely would have recommended, and especially now with things being older and experiencing more death, and definitely for my mother, I wish I had recommended it for her because that was her last parent. Mm-hmm. So at that point, she called herself an adult orphan, as many people do when they lose both parents. But the grief counseling, the social worker, I just think the hospice care team is amazing. And I don't think that enough people understand and know all of what it entails. So I really appreciate you coming on here helping us.
Absolutely. I appreciate y'all asking me because, like you say, people, especially certain cultures, mm-hmm. really, they have to say, oh my goodness, don't tell the rest of the family, yes. Because they're worried that they're going to be looked down on mm-hmm. for putting a family member. It's starting to change a little bit, but it still has a lot of work to get out there and educate everybody how much help, and that Medicare covers it.
That's the beautiful thing.
Yes. That is the beautiful part.
And I definitely think that helping the parent, not just the parents, the family understand and to reframe our thinking, because it's that guilt.
It is.
It's that guilt that we're not doing all that we're supposed
to
to
be
do.
doing.
And as you say, how am I letting them down and all of these things. So helping them through that process, I think that is great, having the chaplain and the social worker, the nurse, and the nurse's assistant. So
It's
whole care team. Yes.
And I have actually been an on-call nurse for hospice, and I've seen just the different personalities,
Dynamics.
yes, and you have to learn to understand it's not about you, caregivers. It's about the family. And even though they're lashing out at you, it's not about you. They're grieving. And I have sat on many floors to help patients and families. And I've driven at 4 a.m. to the 24-hour pharmacies and having to drive out into the hill country from Round Rock at 3 in the morning. Do what you have to do to make sure that your family's comfortable, even if they're crying at 3 in the morning, and you just need to go and be there for them and reassure them. And it is just really great, to have that. And I've had that, from a family member standpoint, when I'm like talking to people and I go, "You're going through this? Did your family contact? Did y'all what?" Yes, contact hospice because you need that. So I'm always happy to see Yoli out in the community, and when she calls and she says she's working with someone, because I always know that Yoli is always going to do what's right for the family and the patient. So I'm just so happy that you agreed to come on and talk about hospice, because I knew you were going to not miss any part of this discussion, because she always gives with her heart. She's always available to anyone to talk about hospice services. Okay. So did you hear her say Medicare pays for this percent?
100%.
100%
means you pay for nothing.
When have you heard of Medicare paying for something? Ever.
Yes. And this is a prime time that you definitely want to make sure that your family is comfortable and that all their needs are met. And if the Medicare is going to pay for it 100%, then I definitely would sign up my family members to make sure that they are comfortable, that they're safe, that they're cared for during that season.
Yes.
Information is what I tell people. Don't wait till it's a crisis.
Right.
Exactly. Yeah, get the information, and that way you can make a sound decision for you and your family.
Exactly.
Mm-hmm.
Well, thank you so much for
You're
coming
welcome.
on today.
Thank you for having me. I really enjoyed it.
We appreciate you.
Yes, we do.
And you guys, if you enjoyed the information, make sure that you contact us at dearencourager.org. You can hit us up on Instagram, Facebook, DM, and please like, share, comment. Thank you, Yoli, once again.
Welcome. Thanks for having me.
Take care.
Bye-bye.
Thanks again for tuning in to Dear Encourager. We hope today's episode brought you comfort, strength, and a reminder that you're not alone. Don't forget to follow us on Instagram at Dear Encourager. Like, subscribe, and share this episode on YouTube, and connect with us on Facebook to stay in the loop with everything we have coming up. Your support helps us grow this space of hope and healing, one listener at a time.